Respected chairpersons and ladies and gentlemen, my talk is on studies on basement membrane of ocular structure in enucleated eyeball in diabetic eyes. I do not have any financial or commercial interest in this presentation. Now, basement membrane are seen in different parts of ocular microstructure. The thickest basement membrane of entire body is the crystalline lens capsule. Biomarkers are naturally occurring molecules by which the particular pathological or physiological process of the disease can be identified. Diabetes affects the basement membrane. It's not moving.
Help them. It's not moving.
Yeah. So the aim of the study is to analyze the basement membrane of ocular structure in enucleated eyeball in diabetic eyes. The basement membrane of ocular structure were studied, their thickness were noted at the sites and compared with age of the enucleation and disease process. 4 cases were diagnosed, were taken for the diabetic eyes. Special stain to stain the basement membrane was done by PA stain. Now, in result, 13 cases of eyeball were studied, of which the 4 were diabetic eye, ranging from 13 years to 82 years. And diabetic eye showed a thickness in the basement membrane of this ocular structure compared to the rest of the eyeball, which were did not have a diabetes. Basic morphometric measurements were done in the series. In discussion, as you know, HbA1c creatinine, basement membrane related collagen, particularly type 4 in tears, can show a relation which can be a prospective study. And DNA and RNA based proteomics, metabolomics or lipodynamics are useful in tears and the corneal button in diabetic eyes. As for a lens sample derived from cataract surgery can be useful tool to analyze the DNA free and DNA evidence that is seen. Now, in iris, the really important thing is the normal pigment epithelium of iris contain moderate amount of glycogen, and glycogen content increases in diabetes. Iris spaces can be seen by doing a PA stain. These vacuoles forms a pigment, melanin pigment are released. These lacy vacuolation are related to the control of diabetes as well as the blood sugar level. They are seen in diabetics when it is more than 200 milligram per deciliter. So this can be taken as one of the criteria for in enucleated eyeball. Basement membrane and ciliary process and diabetes imaging biomarker in this part will give better evidence of the thickening of basement membrane. Retinal vascular changes with subsequent basement membrane defect can predict the prognosis of retinopathy and monitor existing retinopathy and predict a response treatment. Retinal angiogenesis and oxidative stress marker in basement membrane can be a future thought about it. Challenge is that the velocity of the disease development, variation of the phenotype, and metabolic memory and biomarker banking is an important. And this is in the study, the different structures that have, for example, the lens, the anterior capsule has the mean thickness was 16.9 micron, whereas posterior probably is 3.2. So different structure that I've shown, the basement membrane has been seen along with the PA stain. Now, inflammatory biomarker, as you know, there may be a VCAM or ICAM selecting TNF alpha, IL-10, HIF, or a VGF, PEDT, EPO, and TLR can be studied in this. So, in conclusion, basement membrane-based biomarker can be explored in non-invasive technique in tears, can sometimes be looked for in the future. Imaging biomarker and newer automated retinal imaging for early detection of diabetic retinopathy. Some are already there and some may be a prospective one. Basement membrane-based biomarker monitoring can deduce the progress of diabetic change in the eye. These are my selected reference. Thank you for patient hearing.
How many eyes did you do, sir? This in your enucleated eyeball?
13 eyes, sir,
13.
of which 4 had a diabetic history.
Okay.
And one was the postmortem eye of a total 30 years of diabetic in that patient.
Oh, 30 years depth. But study group is 13 eyes only.
Yeah, 13 eyes.
Oh, okay.
Because very difficult to get the eyes and compared with. So this patient which are enrolled as a diabetes in this patient, if they have a what you call eye donation, then we have taken those eyes and we have compared in our studies. Because
Okay.
in India, such studies is not
Okay.
available.
Okay. Thank you.
Thank you, sir.
Now I invite